Assalamu alaikum. Let's talk about toxic shock syndrome toxin. Staph aureus produces an exotoxin called toxic shock syndrome toxin. Toxic shock syndrome toxin is a super antigen that triggers the massive production and release of the cytokine. What are those cytokines? Interleukin 1, interleukin 2, interferon gamma, and TNF alpha, leading to toxic shock syndrome. Toxic shock syndrome is associated with prolonged continuous use of tampons or nasal packing. Toxic shock syndrome presents with fever, diffuse erythematous macular rash, and distributive shock caused by endothelial dysfunction, causing leakage of the fluid from the vascular space into the interstitial space, along with diffuse vasodilatation. The resultant shock and inflammatory state leading to multi-organ failure. Manifestation from the gastrointestinal syndrome include abdominal pain, vomiting, diarrhea, liver failure. Cutaneous involvement may present as a mucous membrane rash in addition to diffuse erythroderma and sloughing. Renal failure manifests with increase of the creatinine concentration, electrolyte derangement, low urine output. Acute anemia and DIC coagulopathy may occur. On neurologic manifestation, encephalopathy, confusion, seizure may present. ARDS is a serious complication. ARDS is characterized by diffuse inflammatory lung injury, in dyspnea and hypoxic respiratory failure, which may require mechanical ventilation. So patients with ARDS and are critically ill, and mortality is increased. And hepatic failure or renal failure are potential consequences from toxic shock syndrome, secondary to hypotension and hypoperfusion.